Hi everyone and welcome. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon. In today's session, we are diving deep into an important and often undiscussed topic, the trade-offs and risks of breast implant surgery. Now, breast implants can offer major benefits from cosmetic enhancements to life-changing reconstruction. But like all surgical procedures, there are long-term realities and potential complications that you need to be aware of. Whether you're exploring implants for the first time or considering explant surgery, this video will help you make informed, empowered decisions about your body and health. So let's begin. We're going to be talking about trade-offs and risks. So what are trade-offs? Trade-offs are not complications. They are expected consequences or features of implant surgery that must be accepted in order to fully benefit from the procedure. Now, an important and well-recognized trade-off of any surgical procedure is scarring. Every surgical procedure creates scars, and breast implant surgery is no exception. Scars are typically located discreetly either around the nipple, within the breast crease, or underneath the arm. Depending on the size of the implant and the size of the pocket, we create scars. However, scars can migrate or shift slightly over time, especially as your body changes. In most cases, scars fade, and they may remain visible or become irritated to some individuals. Accepting the permanence of scarring is a vital part of the decision-making process. Lifelong maintenance of implants. Implants aren't forever. There's often the belief that implants last a lifetime, but that's not quite true. Most implants will need some degree of maintenance or replacement within 10 to 15 years. As your body changes through aging, weight loss, pregnancy, or hormonal shifts, your implants essentially remain the same volume. That means your results may change or become less ideal over time. Regular assessments are essential to ensure everything remains safe, functional, and aesthetically pleasing. Capsule formation. Now, this is your body's own immune response. When any foreign object or any foreign body is placed in the body, the immune system naturally reacts by forming a capsule around it, a thin layer. This happens with implants, and it happens with every implant. In many cases, the capsule remains soft and doesn't cause any issue, but over time, it can thicken, it can harden, leading to a condition known as capsular contracture. This can distort the implant shape, making it feel firm or cause discomfort and pain. Early signs often include a pulling sensation or pain when lying on one side. In more advanced cases, you may need surgery to remove the capsule, particularly if it's visible and painful. And you may need to either replace the implant or we can decide to not have any replacement at all. Aging aesthetics. The implant may not completely change, but you will. Your body is dynamic. It changes with time, lifestyle, and age, and your implant doesn't necessarily adapt to that. So over time, the appearance of your breast may no longer match the original surgical result. What once looked natural and proportional may start to feel too large, too firm, or even uneven. This can lead to a desire for revision surgery, downsizing, or even complete removal. Visible rippling refers to visible folds or edges of the implant being seen through the skin, often due to thin tissue coverage or significant weight loss or a tight capsules. It can be subtle or quite noticeable, especially in certain positions under particular light. Though it's not harmful, it can cause cosmetic dissatisfaction, animation, or movement with muscle contraction. When implants are placed underneath the muscle or the pectoral muscle, they may shift or ripple when the muscle contracts. This is called an animation deformity. Now, for some, it's just an odd visual quirk, but for others, it can cause frustration, tightness, and even pain, particularly during physical activity. I've had patients who ultimately opted for the implant removal because of this issue. Now, let's move on to the risks. Things that may or may not occur, but can significantly impact your health and outcome. The most serious post-surgical complication when it comes to implant. Infection is rare, but when it happens, it can be quite serious. Once or if the bacteria colonizes the implant, antibiotics typically aren't enough. Even if antibiotics initially reduce the swelling or redness, symptoms can often return if the implant itself has become infected, because the foreign material provides a surface for bacteria to cling onto. In most cases, the only effective solution is implant removal. Now, this is a devastating experience for many patients, especially after reconstructive surgery, but it's important to know this possibility still exists. Implants may also leak, so this may be due to capsule causing pressure on the implants or due to trauma, or sometimes no reason at all can be identified that can lead to the implant leaking. Fortunately, the modern day implant contain the leak or contain the silicone within the local area, which means it's less likely to migrate or travel to other parts of the body. However, if the leak has been persistent for a very long time, or you've had implants that have been placed many years ago, the silicone can travel to the armpit or in other areas. I've created another video to discuss leaks, which should appear on your screen, and this will give you a more detailed discussion on how to deal with this. But for now, the leak can present itself as a distortion or misshape of the implant, or it may present itself as a lump into the armpit. This will be another indication for you to have your implants looked at and managed appropriately by your surgeon. ALCL, a rare immune system cancer. Another condition we must address is Anaplastic Large Cell Lymphoma, otherwise known as ALCL. It's a rare form of cancer linked to textured implants. It's estimated to affect between 1 in 15,000 to 1 in 50,000 patients, and while rare, it's a serious condition. Symptoms may include swelling, fluid accumulation, and pain, sometimes years and years after surgery. Treatment involves removing the implant and the surrounding capsule, and in some cases, additional oncological care. If you're considering implants, especially textured ones, the risks should be discussed thoroughly with your surgeon. Other surgical risks: bleeding, pain, and dissatisfaction. As with any surgery, there are risks of bleeding, delayed healing, or chronic pain. In some cases, you can have nerve changes or loss in sensation. There's also the possibility of being unhappy with the results, whether due to sizing, symmetry, or general expectation. That's why a detailed preoperative planning and communication with your surgery is absolutely essential. Breast Implant Illness. Now let's talk about something that has gained increasing attention in recent years. Breast implant illness is a controversial and not yet fully understood condition. It refers to a range of non-specific symptoms that some patients report following breast implant surgery. These symptoms can include chronic fatigue, thinning hair, fragile nails and skin, brain fog, joint or muscle pain, low-grade inflammation, and other generalized symptoms. Because these symptoms overlap with many other conditions, breast implant illness remains difficult to scientifically define or diagnose. There is ongoing debate in the medical community about its cause, prevalence, and even existence. However, what we do know is in some patients, removal of the implant, also known as explant surgery, leads to significant symptom improvement or even full resolution. Emerging evidence suggests that chronic low-level immune response may be triggered by the presence of the implant. This could stem from hypersensitivity to the implant material or a low-grade infection or a biofilm that the body struggles to clear. As surgeons, we take these symptoms very seriously. I listen, we validate what our patients are experiencing, and while the scientific research is still catching up, we understand that for many breast implant illness patients is a real and debilitating experience. That said, it's important to recognize that not all symptoms may be due to the implant. If symptoms persist after explant surgery, it's essential to continue working with your medical team to rule out other causes and receive appropriate treatment. Explant surgery and what to expect. In cases of pain, capsular contracture, breast implant illness symptoms, or personal preference, explant surgery may become the next step. Sometimes we perform an en bloc capsulectomy where the implant and the entire capsule are removed as one unit. This can be more involved and carries its own recovery process, but many patients feel both physical and emotional relief afterwards. Following explant, we'll discuss whether you may benefit from a breast lift, fat grafting, or if you're comfortable going flat or smaller. This is a deeply personal decision, and we will support you. So to recap, breast implants can deliver beautiful, empowering results, but they come with real trade-offs and potential risks. It's critical to be informed, prepared, and honest with yourself about what you're committing to. And if you're struggling with symptoms, pain, or dissatisfaction, know that you're not alone and there are solutions. If you found this video helpful, please consider giving it a like, subscribe, and turning on notifications. We'll be covering more topics like fat transfer, implant removal recovery, and how to choose the right procedure for your goals. If you've got any questions or want to share your experience, drop them in the comment below, and I'd love to hear from you and possibly address your concerns in future videos. Thanks for watching, take care of yourself, and see you in the next one.